The best way to find yourself is to lose yourself in the service of others. This is said by Mahatma Gandhi, and I'm sure a lot of you know him as one of the most charitable men ever to grace this earth. And I find him very inspiring because he took all of his beliefs and somehow incorporated them into one very huge movement, and he got others to follow him, and it was just incredible to see the way that he changed the earth and the way that he did it. My name is Kaushika T, and this year I am studying gastroenterology in the ISM program. First, I'm going to tell you a little bit about me. I come from Assam, India. I was born there, and then I moved to the United States after a month. My dad is an engineer. My mom was a doctor in India, and whenever we moved here, she became a business entrepreneur. And my sister is a freshman at UTD. I myself am a senior at Frisco High School, and in the past few years, I've been participating in tennis, which I've played for about 10 years. I've played flute and piccolo for about 6 years. I'm a really big art freak. I love to stay involved in the art program here, and my dream is to be involved in a program called Doctors Without Borders, which I'll talk more about later. So you hear the word gastroenterology and you think, well, what is that? It sounds big and it sounds fancy. So what it is a study of the digestive tract. So the digestive tract is a 25-foot long tube that processes food along with the liver, pancreas, and gallbladder. So what a gastroenterologist does is he takes in a patient and he'll look at the different symptoms like heartburn, rumbling, nausea, bloating, diarrhea, all of these things, and he figures out what the source is, and that could take days, and it's a profession that requires a lot of procedures like colonoscopies, endoscopies, stuff like that. It's really cool. This year, it skipped over, like, okay, never mind. Can I just talk? Okay, never mind. Well, this year, my mission statement is to go out and meet a lot of different people in my field. I hope to make connections and really figure out what being a GI doctor means, what they do educationally, how they work philanthropically, because that is what I want to end up doing. Doctors Without Borders is my ultimate goal. So far, I've interviewed 4 doctors, not all of them GI, but all of them were somehow relevant to what I plan to pursue. So my first doctor was Dr. Kaplan. He is a colonoscopy doctor, and although he didn't have a lot to talk about for GI, he was able to tell me more about he did the most philanthropic work. So out of all the doctors, he's able to guide me in my original work, which will include philanthropic work. He has his own private practice, and he talked a lot about that, about how it's a lot more grueling and a lot more stressful than being at a educational facility. And he recommended that I go or work under like a graduate school or something like that, because they'll fund you and you don't have to pay for your own office space. And he also talked a lot about how networking is everything. He worked with 2 Harvard graduates during his own med school, and he said that they were probably the main reasons that he got into the the fellowships that he did, because they ended up writing him recommendations, and they got him all the networking that he ended up using later on in his life to make connections and to make his own business and stuff like that. The next doctor I interviewed was an actual GI doctor. She was actually employed at UT Southwestern. So this is a doctor that Dr. Kaplan had been like, oh, you want this kind of job, this is what you're looking for in your future. So it was really cool to talk to Dr. Kubalian. She talked a lot about her college experience because she was pretty young. She talked about how there's a total of 12 possibly 13 years of med school I'll be looking to, 4 years of undergraduate, 4 years of med school, 4 years of residency and fellowship. So that was fun to hear about how I was spending over a decade in school, but she was the most excited about her profession too. Like whenever I walked in, I sat down and she smiled at me, she laughed with me, and she really made me feel at ease. She showed me these awesome pictures of like her funniest patients and her most memorable cases, and she really got me like pumped to be a GI doctor. I was super excited by the time I walked out of there. She also showed me the importance of research. She was actually after she graduated her 4 years of med school, they asked her to stay and be a supervisor and interview residents and fellows and stuff like that. So it was really cool to see directly what they're looking for. And one of the major things that she pointed out was that research is a really big factor. So as one of my goals this year, I really want to see how and what the research, the medical society is looking towards, and what their big trends are right now as far as medicine, stuff like that. So it was really cool to talk to her. Dr. Kellenberger was a physical assistant. He was an ex-GI doctor. He had the sassiest little attitude. He was awesome. But he said, whenever you walk into med school, you're going to meet people who are like, you're not going to make it, and you're not going to get there, so you might as well just quit now. No, like, don't think of it that way. Just relax, get through what you can, pursue what you love, because it will end up helping you on the MCAT, because as I've learned, the MCAT is changing this year, and just pursue what you love and you'll be successful. Dr. Arora was so intelligent. I loved him. He taught me more than anything. He had I want to say one of the better med schools that he was, but it wasn't the intellectual side that he taught me most about. He talked about how doctors tend to internalize the pain of their patients, and it's hard to separate personal and work life. So he really told me that I really need to set aside time for my personal life if I would want to get married, have kids, all of that. So that was really interesting to hear about, and it was amazing to talk to all of them. For my research, I started with argon plasma coagulation, and that's really just a really fancy way of treating spontaneous periampullary bleeding with argon plasma coagulation. Okay, a lot of big words, but it's basically whenever you see bleeding internally, you just shoot a little bit of radiation at it, and it's like, oh, it's healed. So that was cool. Procedures. So I researched how they have to take a lot of different approaches to a procedure with each individual case. So taking up a history is the most important part before heading into a surgery. So that was really interesting. I didn't know that. I was like, if you get to the surgery table, you need to be focused, blah, 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 blah. No, you need to set up to have a good procedure, and then you can have a good one. So that goes along with symptoms. Again, getting a good medical history and a good logging of symptoms is everything. I talked before about Doctors Without Borders, also known as Medicine Sans Frontier, where it is a program independent of any political, religious, and military agenda, where they go to third world countries or any war zones, and they provide medical treatment where it's needed most. And I think that's really cool, because you don't see programs that get a lot of funding for stuff like that are so well known, and it's really generous, and I just think it's amazing, and that's where I want to end up with my life. I talked earlier about how the MCAT is changing. It's more geared toward, first of all, the MCAT is kind of like the new SAT of med schools. So you learn all this stuff, and you go in, and it's a standardized test, so everyone takes it, and that's how med schools will admit you and how you are going to be judged against your peers. So the MCAT's changing. As long as you know your sciences and you pursue what you love, you should be fine. And there are preparatory classes, so that's going to be fun. My dreams, I also researched UTD, because as Dr. Kubilian said, my research will take me will distinguish me from my peers. So UTD, which is where I'm planning to go, does not have a lot of research opportunities, especially in the GI sector, but it does work with kids with disabilities. So that was interesting because they have a really unique program with that, and they allow kind of testing with different medicines and things like that to see how they can help kids with different disabilities, and there's a lot of funding for that. My last assessment was the UNT assessment, where we went to University of North Texas and I took a radiology class that I understand like 30% of, and it was actually pretty interesting though. I really enjoyed it, and I also went to an OChem class where I met this amazing professor, and she talked about the college experience and the jump from high school to college and just general information like that. That was really interesting. For my original work, it kind of ties into my Doctors Without Borders program. It's a program called Compassion, and what it aims to do is provide medical, water, religious relief to third world countries, and you can basically pick a kid and sponsor them for $38 a month. And what I plan to do is involve local restaurants and educational programs to sponsor this by like joint revenue. And my aim as of right now is for $3,000, and also the school will be helping me out, the student council, and hopefully other clubs. But that will be my original work, and I'm really looking forward to it. Thank you.
Right at 12 minutes.